Research shows that asthma accounts for an estimated 10.5 million missed school days, 640,000 emergency department visits, and 157,000 hospitalizations just for children each year. An innovative primary care-based asthma program at the Children's Hospital of Montefiore shows that controlled asthma among children can reduce attacks as well as keep them out of the ER. Here to tell us now more a little bit is a pediatrician at the Children's Hospital at Montefiore, Dr. Karen Warman, and we thank you so much for joining us.
Thank you for having me.
You know, this is an issue that we hit front and center here in the borough of the Bronx, of course, with high asthma rates and really looking at the severity of asthma in our borough. But when we talk about this program, give us a little bit more.
Certainly. Well, we know throughout the United States, about 46% of children have poorly controlled asthma. So that's about half of kids are walking around with uncontrolled asthma. In the Bronx, for children referred to this program, actually 90% had uncontrolled asthma. About 9% of children throughout the United States have current asthma, and in certain pockets of the Bronx, they estimate 25% of kids have asthma. So it's a big problem, and our work is to identify these children and get them better controlled.
How are we going about identifying these kids?
So we started a pilot project in my office where we took kids who were referred by their doctors for further asthma management. We asked 5 questions. These questions are based on the National Heart, Lung, Blood Institute asthma guidelines. They are like this. How many days a week does your child have coughing or wheezing? How many nights a month does your child wake up for asthma? How many times a week does your child need albuterol, a rescue pump? Does asthma interfere with your child's activity? How many times has your child needed oral steroids, prednisone, for a severe attack? And basically, if a child's having more than 2 days a week of symptoms, 2 nights a month with symptoms, needs albuterol more than 2 days a week, or has any impairment of their activity, they have uncontrolled asthma. It's important to recognize these children because there are medications to control them, and we can also look at the environment to see if there are things that can be changed.
Are numbers getting better or worse around here? I mean, we get conflicting reports. What are you finding out?
I think asthma prevalence is pretty stable, about 9% nationwide.
And here in the Bronx, of course, we know that we have our challenges right here. So as kids, you identify these kids. What's the next step after identifying them? What do they go through?
So first we want to figure out, are they intermittent, meaning they only have it once in a while, don't need an everyday medicine, or are they persistent, meaning they have an everyday medicine? That's the first step. Once we know those kids have persistent asthma, they need to be on an everyday controller. And that's a hard thing for a parent to accept and to want to give an everyday medicine even when their kid starts not having symptoms. But the controllers are very, very effective. They reduce asthma attacks, they get rid of that persistent cough, and they just keep the kid more active.
So a parent's watching now and they hear, okay, my son, my daughter might have to do an everyday controller. What goes on from there? Is there a possibility at any time that the child might be able to get off of this everyday controller?
Absolutely, and that's a great question. You know, usually we start with a month or 2 month trial, see how the kid's doing, treat allergies if they're there, take a look at the home environment. Is there a lot of dust? Is there maybe a family pet? Is there a smoker? Anything that, you know, we can change, because ideally we don't want kids on a lot of medicines, only as much as they need.
Now, you did a study and you had about 79 children between the ages of 5 and 19?
Yes, 5 and 17.
5 and 17, okay. And so what were some of the common trends that you were finding amongst these young people?
Well, when we looked at these kids, most of them had uncontrolled asthma. And what we did is we looked at their current asthma severity classification in their chart. Were they intermittent, were they mild, moderate, or severe persistent? And then we assess them using those 5 questions and also having them do a breathing test. It's called spirometry, where the child takes their biggest possible breath in and blows out as hard and long as they can. That's looking for obstruction, how much you can blow out. And what we found is when we asked those 5 questions, their severity was far worse than what was documented in the chart. And when we added spirometry, the severity levels went up further.
Right.
So we're missing a lot of kids who have moderate or severe asthma. And in addition, when we looked at the treatment, many of them needed their treatment increased based on their new severity.
And some of your findings also included among the children that were referred to the asthma program, the majority of whom were Latino or African American. More were identified with moderate or severe asthma that had been identified during routine care.
Yes, routine care, pediatricians, I'm one of them, we work very hard. We're doing the immunizations, the growth, the school. There are a lot of concerns. So that's why I think it's important to do a separate asthma focus visit where you can really dig deep and find out what's going on.
Which is leading me to my next question, because when you talk about going to the doctor, I think, as a parent, you think you do a good job. Okay, I've taken my child to the doctor. I've done what I had to do. I've got the routine care. But obviously, in situations like this, there's a little bit more that needs to go in. What advice do you give the parents, particularly who have to deal with children who have asthma right now, about going beyond the routine care?
Yes, I think it's important to schedule a visit just to focus on the asthma, to have those questions answered, to see how your child's asthma control is. Make sure that you have the aero chamber, this device we use to deliver the medicine, that you know how to use it properly. You have the form for the school ready. You're ready for September. September is when the fall allergies start and the cold, so they're ready to go.
So we did put the website down at the bottom of the screen. Is there any other information or any other way that people can get more information about this?
Certainly they can go to cham.org. They can speak with their pediatrician, make sure their child's on the best possible plan.
All righty. Well, Dr. Karen Warman, thank you so much for enlightening us.
My
and hopefully parents will take advantage of this opportunity, because we definitely have a number of cases here that we have to deal with.
Absolutely. Thank you very much.
All right, Dr. Karen Warman. All right, we're going to take a quick break, but when we return, we're going to introduce you to a program that's making fitness accessible to homeless and at-risk youth. You don't want to miss it. We're coming right back in a few.